we're going to turn now to hearing about childcare across the country. Anne Hedgepeth is here to share with us about childcare trends and to highlight some cool things happening in other states to inspire us. Ms. Hedgepeth is a seasoned strategist in government relations and grassroots advocacy dedicated to driving policy change across all levels of government. She's a senior vice president of policy and research at Childcare Aware of America, and she leads the organization's public policy initiatives and bolsters the advocacy efforts of childcare resources and referral agencies, along with other early learning stakeholders nationwide. Notably, Anne played a pivotal role in securing over $50 billion with a B in COVID-19 relief funding for childcare and early learning. Thank you so much. While also providing essential technical assistance to various state initiatives aimed at creating high quality, affordable, and accessible childcare systems. We need all three: high quality, affordable, and accessible. Thread is a proud member of Childcare Aware of America and partners regularly with Anne and the CCA of A team. Thank you, Anne, for your work with Alaska and to create opportunities for childcare. Please join me in welcoming Anne to the stage and welcoming her for her first time in Alaska.
So while the podium did get moved, I'm actually going to try to do this. I think it's a little easier for me to see everyone and have this conversation today. Appreciate the introduction, and it is indeed my first time here in Alaska, and I'm grateful for the warm welcome I've received already and the chance to talk to all of you all. I am going to be spending some time today helping us zoom out a little bit and talk about what's happening across the country when it comes to childcare. And I will say that the spoiler alert here is that so many of the trends that we've already discussed that are happening in our communities here in Alaska are trends that we are seeing nationally in the childcare system. Prices are high, teachers are bearing the brunt, there's not enough supply. But if you will stick with me for the first part of this conversation, which is about the tough stuff, the challenges that we're facing, I'm going to turn to some of the bright spots, the initiatives that we're seeing in states across the country, some local ideas that are moving forward and supporting the childcare system, and some ways that we can think about taking on these challenges and solving for them in the future. And Alaska's on the list of bright spots, but I still think there are a lot of things we can learn from other communities, other states, legislative initiatives, and things happening on the ground to carry with us. Before I dig in, I want to tell you briefly about Childcare Aware of America for those of you who don't know. We're a national organization that strives to connect every part of the childcare system to make it work better for children, for families, for providers, for businesses, and for communities across the country. And that means that we are fighting at Childcare Aware of America to make childcare more available for working families so that they can access affordable and quality childcare. We're fighting to make sure that more childcare businesses can start and that those that do exist can sustain and hire skilled teachers that stay in the field. At Childcare Aware of America, we are working directly with military families to meet their unique needs, finding childcare and supporting the fee assistance that's passed through to them from their branches. And we're working to push policymakers to act, using information that we learn from across the country, from folks on the ground, and trying to develop the right solutions in the right places and get them done. And part of how we're able to do that work at Childcare Aware of America is with our network of national on-the-ground childcare resource and referral organizations in communities everywhere, like Thread and some other partners in the room. And we're so grateful to have CCR&R's childcare resource and referral organizations in every state across the country that are thinking about the needs of parents, working directly with childcare providers, and strengthening the childcare system overall. So when we think about the challenges that the childcare system's facing, we've heard a lot of them already. And I think it's important to name what some of those trends are nationally, just to get a sense of how, in some ways, we are all in this together when it comes to what we are trying to tackle and solve for across the country. I'm going to start with talking about this issue around affordability for parents. And I appreciate that Stephanie set the stage with some information about what's happening here in Alaska. And the reality is that some of the same things are true in every community across the country. The first thing is that the price of childcare is very high for parents. It's on average over $13,000. And if you have an infant in center-based care, the average price tops out over $15,000. For families with infants in center-based care, that $15,000 is in fact higher than in-state college tuition in 41 states across the country. And I appreciate someone's made this comment already. We talk about saving for college, and the same runway is just not available for families when it comes to their childcare expenses. So it's really alarming, really tells us or anchors that price in something that I think we all know takes a lot of planning and takes up a lot of family budgets. I also want to acknowledge that if you have two kids, you are absolutely putting more money towards childcare than you are towards your rent or your mortgage in 45 states and Washington, D.C. across the country. Childcare is a huge part of family budgets, and those family budgets are being squeezed by so many things right now. The rising price of food, other inflationary pressures, and childcare prices are increasing year over year as well. We saw that trend happen in our annual analysis of childcare prices at Childcare of America. It's really concerning. That's a squeeze, and a squeeze that is not serving our families well. So I'm going to quickly move to talking a little bit then about how prices don't line up with what programs need to cover the full cost of providing childcare. And this is another gap or a trend that we see all across the United States, which is that childcare programs operate on very thin margins. It's been mentioned already in some of the stories that have been shared. I think the provider perspectives we heard about earlier on the panel identified this as a real issue. And we see that nationally, the margins have been estimated to be as little as 1%. Childcare programs don't have a lot of extra funds to work with. And in many cases, these margins are only sustained by underpaying our childcare workforce, something else we've already talked about already today. For such a labor-intensive sector or field of work, to know that on average across the country, childcare teachers are making less than $15 per hour. Only about a fifth of them are receiving health insurance through their jobs. We have nearly 23% who are getting their health care through Medicaid and 16% who are food insecure and eligible for SNAP. That tells us that those margins only work because we aren't fully valuing and covering the cost of our childcare workforce and the labor they do to care for children. And it takes a lot of labor to keep kids healthy and safe and learning all day long. And I think that really tells us about one type of gap that we are trying to solve for here. Prices are too high for families. Those prices don't cover the cost of providing care. We have a real conundrum that we need to solve for. And what also contributes to the issues that we see across the country is, of course, that we also don't have enough childcare available. This actually came up, Stephanie, at our table when we were talking about our wow moments, is sharing what's happening here in Alaska and the gap that you all are seeing and the decline in supply really struck us as something that is where we need to put attention and work. And it's part of a larger trend that we are seeing across the country. Now, overall, Childcare of America did find that the supply of childcare in 2024 eked up a little bit overall nationally, and that is positive news after declines during the pandemic and a rebound back to pre-pandemic levels. We have been really worried that we would start to see an overall decline in childcare supply again, and we may when we look at the numbers for 2025. But what we know is even with a stable amount of childcare, it is deeply insufficient. I want to acknowledge some great work that's been done by Linda Smith and her team at the Buffett Institute, and she's been working in partnership with organizations like Childcare of America and the Bipartisan Policy Center to look at childcare gaps across the country and understand what they look like at a community level. Do we have enough childcare? One of the things that's really interesting about having this conversation is trying to understand how much childcare do we need. And even when we take an incredibly conservative estimate and we just look at families where all available parents are in the workforce, and I think we all know there are a lot of families who would like to utilize childcare where that's not the only factor contributing to why they're looking for access to high quality. But if we just start with those families, we are absolutely not meeting the full need in terms of the supply of childcare across the country, just like here in Alaska. That gap is around just under 30% in terms of the available or the licensed slots in states across the country. And the gap is much bigger in rural areas than it is in urban areas. I do want to acknowledge that the gap in Alaska is particularly high. And one of the great things about this research is that you can see what it looks like in every community across the country. There are a lot of variation, but it's still overall a trend that we don't have enough childcare to meet the needs of families. We also know that it is particularly hard for folks to find childcare if they are looking for care for infants, they have low incomes, or if they are seeking care during, they have unusual work hours. And so they are looking for care before and after work or for longer time periods or even overnight. So all of these things are trends we're seeing, right? Locally, at the state level, and indeed at the national level. And they tell us where we need to be focusing our attention when it comes to some solutions to consider. And I think that is the good news is that there are some good examples of how we can move things forward and make a difference when it comes to strengthening the childcare system. I'm going to start by talking a little bit about what we saw in some states this past year in state legislative sessions. These are not the only good things that have happened. We have a wonderful report available on Child Care of America's website, our state roundup that tells you about all the different things we saw. But I wanted to pull out some key examples of things that states are doing, both with their resources and their policy priorities to try to strengthen the childcare systems in their states. And one of the things that is important to acknowledge is while for childcare, the system is a federal-state partnership, meaning there are funds that flow from the federal government and there are funds that flow from state governments. And there are some rules, mostly floors or guardrails that are set in federal policy. States get to make a lot of decisions around childcare, and they also have a lot of room for growth in their contributions financially to our childcare system. And that's why I think it's really important to look at some of these bright spots in states across the country, because they show us where states are making choices, something else that came up this morning already, to invest in childcare and early learning. So we've seen states lead the charge, putting funding into childcare and early learning. And while all states put some dollars in childcare, they have to actually to match or receive all of the federal funds that they are eligible for. We right now have as many as 6 states that are putting no money in above and beyond that match or maintenance of effort that they have to. And even when some states do put in funds, it's not a lot. So it's very exciting to see states allocate funds, sometimes for the first time ever, above and beyond their match or above and beyond long-term trends of low investment. We saw Arizona take a step this past year by putting $45 million into subsidy, which is the largest state investment they've made in over a decade. We also saw Wisconsin put in $66 million. That's going to be specifically focused on access for 4-year-olds in terms of school readiness, but in the mixed delivery childcare system. And that's the first entirely state-funded childcare initiative that they've had. This is, of course, in addition to their subsidy funding and funding for childcare programs and providers and quality initiatives. We also see states sometimes take on new approaches to funding childcare. And one type of approach that has started to come up, and we may hear a little bit more about this afternoon, is how you can build trust funds or endowments where you can sometimes bring together revenue streams and then ultimately fund or resource childcare and early learning. And while part of it is getting the revenue in, you also have a vehicle and a way to get the money out then to childcare programs or into your childcare system. We've seen some states do that in the past few years. And just this past year, Connecticut and Montana took steps to establish new childcare trust funds. We've already heard about the way in which grants can make a really big difference to our childcare program, about how Alaska's doing work on that front. We've also seen places like Massachusetts and Wisconsin put resources into those foundational or stabilizing grants that help childcare programs stay open and serve children. And we've also seen investments across the country targeted towards our childcare workforce, towards compensation and workforce supports that can make a big difference in reducing turnover, increasing retention, and generally bringing up compensation in the workforce. Illinois is a good example of a state that puts resources into workforce grants, and they made a large or a meaningful increase this past year to ensure that there are wage increases. We've seen a number of states make it possible for childcare providers to be qualified for subsidy for their own children who need to be in childcare, helping to defray those costs and make it possible for them to take jobs, to work in the childcare programs that benefit all of us and power our economy. States like Arizona and Iowa, Rhode Island and Oklahoma and Texas are all places where those initiatives happened this past year or grew over the past year. And we've also seen work go into things like substitute pools or ways that we can make our childcare workforce stronger, not just the individuals themselves and their compensation, but the supports that they get and the supports that childcare programs get. It's interesting, even in the 24 hours that I've been spending with you all, I have heard of multiple examples where we have programs across the state where a lack of a substitute or a backfill creates a challenge for a childcare program. And while you have to figure out how to solve for the different types of roles you have in a program, there can be value in thinking creatively about things like a substitute pool, like New York has done, and putting resources into it. We've also seen some really great initiatives across the country that leverage private and public partnerships. Some that start like in Iowa with an initiative out of a foundation where ultimately employers are pooling their money. The state is also contributing, and those funds are going to the overall supply of childcare or the support for the workforce, not just contracting for individual slots for an employer. It's a really innovative way of getting businesses to see a responsibility and a connection to the childcare system as a whole, not just to having an open or vacant slot. If we build the supply overall, those employers benefit. We've seen some states take on tri-share programs where there are contributions coming from the state, an employer, and an employee, all to meet the fee that a childcare program charges, help it make it possible for an employee to find and pay for childcare. And we've also seen incentives starting at the federal level, in the instance I put on the slide, for semiconductor manufacturers like Intel and Micron to be required to receive their federal funds to invest in childcare for their employees. These are all great ways that change is being spurred, and some of them are even helping us build the childcare system stronger as a whole, not just match up employees with a slot for their kids. The last big thing I wanted to touch on is a recent announcement out of New Mexico, which I think is offering us some suggestions for a way forward to large-scale change in our childcare system. And while this announcement has just happened, what has been going on for several years in New Mexico has really set them up for success. In New Mexico, they had taken steps to unify governance, to have a cabinet level official, to go ahead and reimburse childcare providers for the full cost of providing care, and to expand their subsidy system over the past several years. They have now announced that they are moving towards a system where families who work or go to school will be able to get childcare assistance with no income limits, and they will have no copays. That's moving us very close to a universal system and really is exciting, I think, for families in New Mexico to see this lofty goal and the state's commitment to getting there. The state is also going to think about the supply side of this equation. They are, like I mentioned, they are making sure that providers are being paid for the full cost of providing care, and that includes an increase in compensation for their childcare workforce. They're investing in supply building, opening new homes, getting them licensed, and opening new childcare centers across the state. And the state does have the benefit of a permanent land grant fund that can put money into childcare and early learning, though they are also making the choice of using state general funds that will be requested in their annual budget to make this happen as well. The buy-in will require state legislative action, but the governor is leading this initiative and will be making that request. Good to know it's out there and something for us to look at and understand how we could set ourselves up on this path towards a system like what New Mexico is doing to make access even more available. The last thing I wanted to mention is that, and I appreciate, I got a question yesterday evening, and Stephanie actually prompted me to make sure I didn't forget to mention that it is not a foreign concept, I think, to us as a country and a society, and to our federal government to see childcare as a priority. Our military believes, full stop, that childcare is a force readiness issue. They are the largest employer in this country, and they put funds into child development centers on installation, into a robust fee assistance program across the country. And when there are problems, which there is not enough childcare to go around, they are working to figure out what solutions are, requesting more money, and figuring out what to do. The One Big Beautiful Bill had additional resources for military childcare. And I think it's a reminder to us that there's a real opportunity to learn also from our military childcare system as an example of how to set the stage for high quality childcare, put resources behind it, and then iterate and evolve to continue to make the system stronger to meet the needs of all families. So another good example of where we can go when it comes to solutions around childcare. We have a lot of challenges in common across the country. We also have a lot of examples of what we can do next. And so I am going to, I think, pivot us to our next session, where we're going to talk a little bit more about those challenges and opportunities. And I think we'll make some time at the end of that discussion for questions and answers. So thank you.